Oh, wow. In my professional opinion, that was not roughing the passer.
I got bones. I got bones. I got 206. I got 206. I got.
Wow, that's the first time I've actually seen this clip. I did see the press conference where Drew Brees was saying that he was not going to be able to be effective, and I can understand why.
Pocket collapsing on Drew Brees, and he gets drilled by Kentavious Street.
So the big question is, do you start Jameis Winston or Taysom Hill until he recovers? Looking at this and hearing what he said, my initial thoughts were probably broke his rib. But he also fell on his shoulder, so that might be an issue. If he's broken his rib, you don't really operate on broken ribs, but this is probably why he was saying he wouldn't be effective. If you have a broken rib, every time you take a breath, that broken bone moves and it hurts like hell, so you splint. In other words, you don't take deep breaths because it hurts. Let's say it's not a cracked rib or a broken rib. The pain is still pretty bad with cartilage damage because you can have a crack in the cartilage, it's bruised. Same thing will happen. You take a deep breath. Every time you take a deep breath, your chest expands, puts tension on that injury. It hurts, right? And you won't want to get hit again there. So, broken rib or not, cartilage damage, it's going to hurt. He's going to be out for a while. The golden number for some reason in orthopedics is 6 weeks. Injuries tend to kind of heal in about 6 weeks. So 6 weeks from now, that puts him at the end of December. So worst case scenario, he's back in time for the playoffs. Although, like I said, athletes are kind of a different breed. They can heal a lot faster. Also, if he does have a broken rib or if there's cartilage damage, there are devices called bone growth stimulators. And what they do is they send little pulses to the bone cells or the cartilage cells and vibrate them, and it releases cytokines, in other words, cell molecules that help that bone or that cartilage heal faster. So that can speed things up. This is probably what they're going to do for him. As well as other treatments that I may not know about because that's pretty high caliber medicine that they do for these athletes. Probably going to be okay by the playoffs. So the big question is, do you start Jameis Winston or Taysom Hill until he recovers? Jameis Winston, on one hand, he'll get you a lot of touchdowns, but he may get you just as many interceptions. And truthfully, is Taysom Hill even really a quarterback? He seems a little bit more like a running back. Who would you put in?
I got bones. I got bones. I got 206. I got 206. I got